Dr. Jonathan Barnes starts his night shift at 9 tonight, but at 8 tomorrow morning he'll join his colleagues on the picket line at the start of unprecedented strike action.
Initially I had some anxiety and trepidation, but I've been reassured by my consultants that there will be full cover and they will be providing it. I think in general the whole dispute, including the fact that doctors have been pushed to taking industrial action, makes me very upset and very sad, and I'm very worried for the future not just of my profession but also of the NHS and the patients who rely on it.
Hospitals have had to rejig their normal working patterns to free up consultants so they can cover for their striking junior colleagues. It means more than 12,000 operations have been postponed that were scheduled between last Monday and next Monday, and more than 112,000 outpatients appointments have also been postponed. Within the last hour, the Health Secretary made his position crystal clear.
The new contract offers junior doctors who work frequently at weekends more Saturday premium pay than nurses, paramedics, than the assistants who work in their own operating theatres, more than police officers, more than firefighters, and nearly every other worker in the public and private sectors.
New contracts, we say no!
And the union, whose members will strike tomorrow, also insists there's no going back.
We're only doing this because the government has given literally no other choice and has announced that whatever happens, it will not change its mind about imposing this contract that nobody wants and in which everybody feels is going to be unsafe and unfair for the future of British medicine.
A view supported by many senior medical figures, including Labour peer Professor Lord Robert Winston.
Jeremy Hunt is making a massive mistake here. There really is a need for a compromise, and I think that the doctors will be happy to accept a compromise. These are altruistic people, and they don't want to strike. They don't want to withdraw their labour. And obviously the hope is that patients will not be damaged, but even delaying operations is not great.
This will be the first all-out strike in the history of the health service. Doctors and ministers are in dispute, but it's patients who will feel the impact.